Local 4 News at 11 starts right now.
They're the group of women at greatest risk from swine flu. Expectant moms. So far, pregnant women have experienced more than their share of complications from the H1N1 virus. Dr. Frank McGeorge is here with important information for expectant moms and their babies.
Pregnant women will be the first in line to receive the new swine flu vaccine when it becomes available in October. And whether to get this shot is a decision every expecting mom is going to have to make very soon. Moms-to-be say, given the risks from the virus itself, it's a tough time to be expecting a baby.
Hi, Danielle. How are you?
Hey, how are you doing, Dr. Campbell?
Danielle Holland from Westland is due with her first child on September 30th. She's been concerned about swine flu since learning she was at higher risk for problems because of her pregnancy.
I was worried about my health. I was worried about if I got infected, what would happen to the baby. I was worried about possibly losing the baby.
So Danielle has been doing her best to avoid the virus.
I don't have any skin left on my hands for how much I use hand sanitizer. When I go to church, I no longer take communion, and I don't do the peace be with you in church because I don't want to have contact with people who could possibly have the virus.
But in spite of all of her efforts,
I did come in contact with someone yesterday who thought that he might have the swine flu, and as soon as he told me this, I was very concerned.
Danielle immediately called her doctors at Women's Health and Menopause Center in West Bloomfield.
They put me on Tamiflu as a preventative measure for 10 days. I'm 38 weeks pregnant, and the last thing we want is for me to be sick when I deliver the baby.
Pregnant women are uniquely susceptible to breathing complications from H1N1.
Dr. Kelly Campbell says pregnant women shouldn't panic, but they should use common sense to protect themselves. And if they think they might have the swine flu, she's urging them to rush to the phone, not the doctor's office.
The worst thing you can do is to go to a busy obstetrician's practice and expose all of the patients in the waiting room to the virus. If you have symptoms of the flu, if you have a fever, muscle aches, joint aches, a cough, to stay at home and call your health care provider and start the Tamiflu as soon as possible.
Campbell says she'll be getting the H1N1 vaccine herself, and she has no qualms about recommending it for her patients.
I'm telling patients that they absolutely should when it becomes available, and that they should also receive the seasonal flu vaccine, which is available currently.
Danielle has already made her decision.
I will definitely get the vaccine. I will get the vaccine to protect my child. At that point, I'll no longer be at the elevated risk, then I won't be pregnant anymore, but the baby will be at risk since he has such a weak immune system. So I will definitely get the vaccine. I'll be first in line.
Danielle doesn't know if she's having a boy or a girl. She just knows she wants her baby to be healthy.
I'm nervous about it being flu season when I do have the baby, but I am very excited that the baby is coming. So any day now.
Pregnant women do pass some of their immunity to their babies, so the hope is vaccinating expectant moms will also help protect their babies after they're born when they're at high risk for the illness, but too young to be vaccinated themselves. The bottom line, this is something every expectant mom needs to discuss with their own doctor very soon. That's Good Health. Back to you.